Today we're covering everyday items and situations that could be compromising your health. This next story, it started with a cough, something most of you would never suspect to trigger the need for surgery.
A little over 3 years ago, I ended up with bronchial infection, pretty violent cough. The pressure from the cough caused my uterus to drop and start to fall out. I did feel when it actually happened, it was an odd sensation. It was just the more I coughed, the more pressure, the more I felt things were actually falling and protruding. That's when I went to see Dr. Steinberg.
Lisa suffers from a very common condition known as prolapse. And prolapse causes the uterus to sag into the vaginal canal. So what we're going to do is I'm going to make small incisions in your abdomen, and through those incisions I'm going to do a hysterectomy where I remove your uterus.
I'm nervous, but I really trust Dr. Steinberg. I'm looking forward to the surgery so that my quality of life can improve.
We're going to take a look at Lisa's hysterectomy surgery in just a minute, but first, talk to us, Dr. Lisa, about how uterus can actually fall out.
Well, there's a lot of things. Those muscles, those PC muscles, those are pelvic floor muscles that you do when you do your Kegels. Those are so important because they help keep the uterus up. And you can see here, this depicts the uterus and how it can come down into the vaginal vault. Usually this happens because of multiple pregnancies. Basically, those muscles would get weakened just by carrying around a pregnancy for 9 months, as well as labor. The bladder can come down, the uterus can come down, or the rectum. We women have a lot of things going on.
So if you're bearing down as a woman and you've had many pregnancies, you're maybe a little older in life,
you're going to push that down even more, puts even more pressure on top of those pelvic muscles. And if they're already weakened, that repetitive coughing over time is going to weaken them even more. It's sort of like, just as you had in that picture, if you say this is the uterus and then say you cough, basically, really, you can, and we see this, I see this all the time as a gynecologist, women coming in and their uterus is outside of their vagina. And what they do, they actually will say they have a bulge in their vagina. This causes a lot of problems because it can get dry, because it's not going to have the mucus that's inside that keeps everything moist. So you can have erosions in the skin, which can cause odors, and obviously can cause problems with intercourse, and you can have problems with your partner. Now, usually to fix this problem, you do this with a hysterectomy. Hysterectomy just means removal of the uterus. There are lots of different ways to perform hysterectomies. You can do them abdominally, you can do them vaginally, you can do laparoscopic assisted ones, and now we've introduced robotically assisted laparoscopic surgeries.
And in the case of uterine prolapse, this can be a cure, and we actually took a look and saw how Lisa's hysterectomy surgery went, which was her treatment for uterine prolapse.